to look at discomforts in pregnancy. So by the end of this session, we believe that you will be able to explain the different discomforts incurred during pregnancy, state the nursing care for the different discomforts in pregnancy, outline the required preparation of a pregnant mother for labor. As usual, my name is Kiden Robina, and I will be taking you through this session. So let us look at during the first trimester, the discomforts that the mother is likely to experience. So during the first trimester, the first discomfort she may experience is urinary frequency or incontinence. And this is due to the fact that at this level of pregnancy, the uterus is still with a pelvic organ. And as it expands, it exerts force on the bladder. So the bladder will not be able to accommodate its usual quantity of urine that it would accommodate. So as a result, the little urine that accumulates within the bladder, the mother feels like passing it. So that is why there's this frequency of urination. So pelvic floor exercises to increase control over leakage can be encouraged for the mother so that she can be able to manage this problem. Empty bladder when you first feel a full sensation. So the mother should not hold the urine. If she feels the urine and she holds it for some time, it can lead to the incontinence. Then avoid caffeinated drinks, which stimulate voiding. Caffeinated drinks like strong coffee and the other drinks like sodas and the others that can lead to frequent urination. Then reduce fluid intake after dinner to reduce nighttime urination. But we still encourage that the mother should take enough fluid to make sure that her body is hydrated enough to avoid issues of dehydration. Then the other discomfort she is likely to face is fatigue. So in case of fatigue, uh, first of all, this fatigue is brought in majorly because of the changes in the hormones and some of the hormones that are produced during pregnancy can create that body weakness. The mother feels like she has done much work and she's exhausted. So this normally happens first in the first trimester, then also later in the pregnancy. So in the first trimester, we encourage that the mother has make sure that she gets full sleep. When she sleeps, she should not be interrupted. She should at least sleep for more than 6 hours, or if possible, should be 8 or more hours to make sure that she exhausts the sleep and the body has enough rest. Then also, if possible, she can schedule a nap immediately after lunch in the early afternoon hours to make sure that she rests a little. Then, if at work and she gets some break, then she can lift her legs up to ensure that she relaxes a little bit. Then we encourage that the mother also has a balanced diet. We encourage that the mother has a balanced diet. The diet should not be more of carbohydrates because we realize that if she consumes more of carbohydrates, because the digestion of carbohydrates in the stomach is very minimal, it can lead to her feeling exhausted and tired all the time. So if she's to have her food, the food should be a balanced one. Then another discomfort is nausea and vomiting. This nausea and vomiting, like we explained previously, is brought mainly due to the changes in the body hormones, and it happens mostly in the early morning hours, and that's why it is called sometimes morning sickness. So by the time when the sun rises at around 10, it normally clears off. So when the mother is experiencing this, we encourage the mother to avoid any empty stomach at all times. At least she should take something to make sure that the stomach is not empty all the time. Then eat dry crackers or toast in bed before arising, and also she should have hot tea. This can help to manage this problem. The mother should also eat several small meals throughout the day. She cannot sit and eat full complete meal at once, but if she eats and skips some time, then she eats again. It can be very okay. It will help to manage this situation. Avoid brushing teeth immediately after eating to avoid the gag reflex. Then drink fluids between meals rather than with the meals. So it's encouraged that the mother has to eat and complete her meal, then wait a little for some minutes, then she can now take the fluids. But if she eats while drinking, it will make her to have this problem of nausea, or sometimes she can end up vomiting. Avoid greasy fried foods or ones with a strong odor, such as cabbage, because these ones can also stimulate that feeling of nausea, and she may end up vomiting. Breast tenderness, advise her to wear larger bra to make sure that the breasts are comfortable, and the breast should not be squeezed. This is because we previously we mentioned that when the mother is pregnant during the first trimester, she experiences enlargement in the breast, and there is that tingling sensation that she always feels. So it will be a little discomforting if she puts on bras that are tight. So we encourage that she puts on bras that are at least large to make sure that she feels free. Then also we encourage that she should not stay without bra, because the she will not be comfortable with the breast. The breast need to be held a little. Her supportive bra even while sleeping. So she can get a supportive bra that she can put on even while sleeping, depending on the degree of discomfort that she gets. Mothers who have big breasts always get more discomfort than the ones with the small breasts. Another discomfort is the constipation. Constipation also happens in the first trimester. So this can be managed through increased fluid intake to make sure that at least the stools are soft. She can also increase the intake of the fiber, and also drink at least 8 oz glasses of fluid daily to make sure that she's well rehydrated, and the stools are at least soft when they are formed. Ingest prawns or prawn juice, which are natural laxatives. Consume warm liquids such as tea on rising to stimulate peristalsis. Exercise each day. Brisk walking exercises to promote movement through the intestine. Then reduce the amount of cheese consumed. So cheese in our local setting here is not so common, but we at this level, of course, we encourage that the mother eats what is she is comfortable with, but all those foods that she is not comfortable with, we tell her to avoid. But specifically for the cheese, if the mother is a fan of cheese and she has been consuming it, we tell her to reduce a little because it may increase the constipation. Nasal stuffiness, bleeding gums, and the epistaxis. So this also happen in the early pregnancy, and the mother will keep on complaining that she is having flu throughout. But in most cases, is it because of the changes in the hormones? That is why she's having that congestion in the nose always. So this can be managed by we advise the mother to drink extra water, also to use a cool mist humidifier to make sure that at least the stuffiness in the nose melts off. Then you blow one nostril at a time gently to prevent impact that may be felt in the ears as she is blowing. So she should blow one nostril at a go. If epistaxis continues, avoid the woman to loosen, advise the woman to loosen the clothing around her neck, sit with her head tilted forward, pinch her nostrils with her thumb and the forefinger for 10 to 15 minutes. So, epistaxis is that bleeding that normally comes from the nose, and in most cases, it can be unexplained. It happens and it starts coming from the nose, and this can be common during early pregnancy. So, um, if it happens and it continues for some time, we encourage what I have already mentioned here. The mother should loosen her clothing around her neck, sit with the head tilted forward, then pinch the nose for 10 to 15 minutes. Then apply an ice pack to the bridge of her nose, and this in most cases can help reduce this problem. Encourage good oral hygiene by using soft toothbrush and flossing daily. Then warm saline mouthwashes. Do not use any antihistamines, otherwise it may bring complications. Cravings. If it's clear, cornstarch, laundry detergent, baking soda, soap, dirt, ice, or wax. Uh, this is likely to be thicker, and this is common, of course, during pregnancy. So, and this indicates that her dietary needs are high, meaning she has dietary deficiency. So we encourage the mother to balance her diet, and as a result, also we tell her about the dangers of consuming dangerous food items such as alcohol, because this may end up affecting her and also the fetus. Leukorrhea. So, in the normal woman, there is a vaginal and that is well known. During pregnancy, this vaginal discharge increases in amount, and this is what we refer to as leukorrhea. So, when the woman is having leukorrhea, we advise women to keep perineal area clean and dry. So, if it is itching, she has to report to the health facility to make sure that she is treated immediately. She can wash with mild soap and water. We advise her to use cotton underwear. The nylon underwear encourages growth of microorganisms and can end up making her become sick. Then she can put on nightgown instead of pajamas. We also encourage her to avoid dodging and tampon use to experience backache. And this backache is normally due to the lordosis. This is because there is increased uh, enlargement of the abdomen. So when this one increases, it gives this, it brings about lordosis. In this case, the knee. So in this case, due to lordosis, we encourage the mother to kneel and arch back to relieve or stand and tilt pelvis. So she can also elevate legs above heart level frequently throughout the day if she is resting. If you get a cramp, if the mother gets a cramp, she has to straighten both legs and flex the feet toward her body. Then we also encourage her to ask the health provider about taking additional calcium supplements which may reduce leg spasms in case she is having that problem of cramps. Varicosities of the vulva and the legs. So in this case, if she has varicosities, I had talked about this in the previous teachings, and we saw the images of varicosities. So the one that we saw was on the leg, but this can still spread up to the vulva and makes delivery through vagina a complication. So we encourage her to wear stocking and keep legs elevated. Walk daily to improve circulation to extremities. Then elevate both legs above heart level while resting for 10 minutes to make sure that there is ample return of the blood to the heart. Avoid standing in one position for long period of time and don't wear constrictive stockings on the socks. Then don't cross the legs while sitting for long periods. Wear support stockings to promote better circulation. Then the other challenge is the hemorrhoids. Hemorrhoids. So for the case of hemorrhoids, the mother can use creams which can be topical anesthetics to reduce pain, stroke itches, or avoid straining. So, we encourage the mother to establish a regular time for daily bowel elimination. Regular time, like if she always goes in the morning, she should be going in the morning, maybe morning and evening, like that, so that it avoids that stress. If the hemorrhoids are stressed, if the anal opening is overstressed all the time, passing of the stools, it can end up being ulcerated and it can end up developing. Avoid constipation and straining during defecation. Then prevent straining by drinking plenty of fluids and eating fiber-rich foods and exercising daily. Use warm seats baths and cool witch hazel compresses for comfort. flatulence with the bloating. So if the woman is facing this uh, challenge of flatulence with bloating, we encourage her to avoid the gas forming foods when in public. Then uh, reduce gas forming foods such as beans, cabbage, onions, foods high in sugar, carbonated beverages, and the cheese. Then eating means we encourage her to eat means uh, may help reduce flatulence. In the third trimester, the woman we encourage the woman also to be aware of the fact that she is likely to experience the discomforts that she experienced in the early pregnancy. This is because in the third trimester, the head of the fetus or the presenting part sinks now into the pelvis. And once this happens, that challenge of the pelvic organs being compressed will still occur, and as a result, the mother may end up with the same challenges that were faced during the first trimester, such as the frequency of urination and the others, leave alone the vomiting. Return of first trimester discomforts due to lightening. This one I've explained it. Shortness of breath and the dyspnea. This challenge that you may face. Then another challenge you may face in the third trimester is the heartburn and indigestion. So small frequent meals can help. We encourage her to avoid spicy or greasy foods and eat small frequent. She should also sleep on several pillows too, so that her head is elevated around 30 degrees. We should avoid smoking and avoid caffeinated drinks to reduce stimulation. Avoid lying uh, down for at least 3 hours after meals. Because when she lies down immediately after meals, uh, because the stomach is full and stomach is already being compressed by the enlarged uterus, the sphincter may end up opening, and as a result, the gastric content end up leaking into the esophagus. In most cases, that heartburn and it can create indigestion. Try drinking sips of water to reduce burning sensation. Then avoid foods that trigger symptoms. That burning sensation, like fried foods, citrus, soda, and chocolate. Then the other challenge can be dependent edema. So for the dependent edema, we encourage her to elevate the legs if the stays uh, if the edema stays, it's not minor disorder. So if she elevates the legs and the edema still remains, it means this is not a vital disorder. She needs to see a doctor so that it can be managed. It could be another complication of a major sickness. Then Braxton Hicks contractions. Uh, this is because of the changing position or mild exercise. This is because of the uterus practicing going into labor, and it mostly happens in the third trimester. So the mother can be encouraged to change position or do some mild exercise to reduce the sensation. Drink more fluids also to manage that. Then nursing management to promote self-care, sexual activity and sexuality. Reassure that sexual activity is permissible unless mother is having normal bleeding, placenta, previa, risk of preterm labor, cervical insufficiency, and premature rupture of membranes or infection. Another one is employment. Use break time to elevate legs. If she is at work, we encourage that the mother can use the break time to elevate her legs uh, for around 10 to 15 minutes within 8 hours of the working of a work day. This can be of help. Avoid jobs that require strenuous workouts. Change positions frequently, sitting to standing every 2 hours. So you sit for like 2 hours, you can stand for like 2 hours also, or you can stand for like 30 minutes, then you sit again for 2 hours like that. So that changing can be of help. Make sure work environment make sure work environment is toxic substance free and smoke free. So don't stay in an environment which has toxins or toxic substances or smokes that may be dangerous to your health or the health of the baby. Then travel referred to not travel. After third trimester, should be advised to go overseas. Avoid driving when fatigued and late in the night. So within the first and the third trimesters, we don't encourage the mother to drive when he's feeling weak and also late in the night because this could be dangerous for her. Immunizations and medications. Disclose any medicines to the health care practitioner. Should be considered hepatitis B, influenza injection, uh, should be given to the mother. Tetanus, diphtheria should also be given. Meningococcal rabies should also be given. So currently at our setting, what is mandatory for all pregnant mothers is uh, the tetanus toxoid injection, which is given 5 doses for the mother to complete. So the good news is that it is started during the reproductive age. So by the time the mother conceives, she will, if she had worked hard, she will just be getting a booster dose. But if not, she is supposed to be given at least 2 doses before she gives birth. Contraindicated during pregnancy are the influenza, nasal spray, measles, mumps, rubella, varicella, BCG, meningococcal, and the typhoid. These are the ones that are contraindicated during pregnancy. Why? Because the immune system of the mother is low, and if it's given, she may end up falling sick of the diseases that would have been prevented. But this can be given in the pre-conception care. When we talked about the pre-conception care that the mother is supposed to get before she conceives, we mentioned about these vaccines as one of them that can be given to the mother before she conceives. Preparation for labor, birth, and parenthood. Options for birth setting. The mother can decide to produce in the hospital, uh, in the delivery room, or in the bathing suit. Birth centers or in the home can be in her own home. So options for care providers, she can choose to use obstetrician, a midwife, or doula. The doula is a birthing coach who can help her during the delivery. So, what does the doula do, or birthing coach? She provides encouragement but do not perform any clinical procedure, but she will be there to encourage the mother on being strong throughout the labor. Feeding choices, breastfeeding advantages and the disadvantages. So the mother needs to be briefed on breastfeeding, the advantages and the disadvantages of breastfeeding. Nurse should emphasize on positive aspects and encourage the mother to breastfeed. Um, Mothers who are HIV positive ideally are not supposed to, are not encouraged to breastfeed. Mothers who have active tuberculosis, illicit drug takers, or those prescribed chemotherapy agents should not breastfeed. But at our local setting here, mothers who are HIV positive are allowed to breastfeed until exclusively until the 6 months without giving the baby anything, because a study shows that when they prevented these HIV pregnant mothers from breastfeeding, because most of them could not afford uh, breast milk, bottle milk, most infants ended up dying before they could even reach their first birthday. But when they encouraged the mothers to breastfeed exclusively for the first 6 months, then now they start giving the child food after 6 months, it now reduced on the death rates of the infants. Now, at our local setting here, while we encourage the mothers to breastfeed exclusively for the 6 months, while she is breastfeeding, we tell her to watch out. If her breasts are having wounds, she should not breastfeed. If the child is also having wounds in his mouth, she should not breastfeed the child, because these are the instances when the transmission can end up occurring. Advantages: breastfeeding costs less. The mother-child bonding is promoted. Ovulation suppresses. That means that when the mother is breastfeeding, ovulation will not take place in most mothers, apart from just a few who may end up ovulating while breastfeeding. Promotes weight loss. Oxytocin released to promote weight loss without dieting. So the mother can be able to lose that excess weight that she gained during pregnancy if she breastfeeds her baby, because of the oxytocin that is produced. It encourages the loss. It promotes the loss of weight. Then disadvantages. There is of course the breast discomfort that the mother feels, sore nipples, and if the mother does not breastfeed the baby frequently, can end up the mother can end up getting mastitis. Then milk stasis. If the milk is much, can end up creating milk stasis in the breast. Then vaginal dryness, decrease the libido, because most focus will be on the baby and taking care of the baby, and the release of the oxytocin hormone can also end up reducing the libido. Bottle feeding, advantages and disadvantages. The advantage, the father can join and give a hand in caring for the baby, because this does not mean that it needs to be done only by the mother. Disadvantage is ensuring the temperature is correct and the bottle is sterilized. This is a very serious work that needs to be done by the caretaker. Increased risk for otitis media, asthma, atopic dermatitis, reflux, diarrhea, constipation, lower respiratory tract infection, all those ones can be related to bottle feeding. Then teaching. Feed baby in semi-upright position using cradle hold. Hold the bottle so it's kept full of formula to prevent excessive air. Feed every 3 to 4 hours. Do not probe bottle because when you probe the bottle, it can cause choking. Then frequent burping. Every once you need to burp the baby to make sure that the baby releases the gas that he has sipped. Final preparation for labor and birth. Attended childbirth preparation classes and practiced breathing techniques. So for our case here, we do these preparations during antenatal, and we encourage that during the third trimester, all mothers are taught on this, and they they present what they have already prepared for their birth. Then selected a birth setting and made arrangements there. So she should be aware of where she is going to deliver from, and the people there should also be aware that she will be going to for delivery at their place. Know what to expect during labor and birth. She should be aware of what is likely to happen during labor or birth, and she should be ready for it. Touch toward, toward the bathing facility. Should have moved around the bathing facility and should know where exactly she will go when the labor starts. Packed a suitcase to take to the bathing facility when labor starts, made arrangements to have siblings and or pets taken care of during labor. So while she is laboring or while she is in the hospital, there should be someone to take care of the home, someone to be around and take care of the children and the baby at home. Being instructed on signs and symptoms of labor and what to do. Know what to do if membranes rupture prior to going into labor. What should she do? Because these are some of the things she should watch out for. Then know how to reach their healthcare provider when labor starts. Communicated their needs and desires concerning pain management, whether she would like to use analgesics to manage the pain or not. Then discuss the possibility of a cesarean birth if complications occur. Discuss the possible names for the newborn. This can be done as a family. Selected a feeding method, breast or bottle, with which they feel comfortable. Made a decision regarding circumcision if they have a boy. Then purchased an infant safety car seat in which to bring their newborn home. This can be in preparation if they have that capacity. Then decided on a pediatrician, have items needed to prepare for the newborn's homecoming, that is infant clothes in several sizes, because as the size of the infant increases, they may need to change the cloth. Then nursing bras for the mother specifically, because after delivery the breasts are going to increase, so she should have those nursing bras. Then infant crib with the spaces between the slats. that are 2 in or less apart. Diapers, cloth or disposable. Feeding supplies, bottles and nipples if bottle feeding. Infant thermometer for checking the temperature of the infant. Selected a family planning method to use after the birth. So these are the preparations that she can make. Thank you so much for being part of this lecture. Thank you for being attentive. God bless you.